The new upsurge of COVID-19 cases currently in the country are entirely blamed on the laxity of the standard operating procedure and guidelines put in place by the Ministry of Health.
Most of people are not following the public health precautions like wearing masks, hand hygiene, distancing, as well as vaccination. We are not reaching a stage of vaccination which would give enough herd immunity to suppress any potential upsurge.
The World Health Organization country representative Dr. Jonas noted that COVID-19 vaccination rate in the country is still low to give herd immunity against the virus.
And in the case of Uganda, I think we haven't reached an optimal level of vaccination of the population, which means we are still vulnerable. But we have opened up, and we are not strictly following the SOPs. And of course, for some of the people who have been vaccinated, I think some of the immunity is decreasing, so the vulnerability is there.
According to the World Health Organization statistics, indicate that even the people who are fully vaccinated, immunity decreases after 6 months. Thus, a need for a booster COVID-19 jabs.
The current data is indicating that we need a booster dose after 6 months of the last completed vaccination. For more vulnerable people, for people in older age who has comorbidity, those people with immunological issues, immunodeficiencies, cancers, and so forth, we might even need to prioritize in the second booster, not only the first booster. Those people should also consider and take a second booster to get the best result from their vaccination.
The new COVID-19 positivity rate is currently at 3.4%, as the World Health Organization representative explains.
We haven't reached the critical level. We say when we reach about 5% positivity or of the cases, or when we have numbers which are showing us doubling of cases, we start to be worried. Currently, what we are seeing when comparing the previous week with this week, we are seeing, for example, we have almost now around 3.4% positivity. Last week it was 1.5, the previous it was 0.9, and the previous it was 0. So definitely we are seeing an increase.
He appealed to the public not to lower their guard and religiously observe the public health precautions and guidelines put in place.
COVID is here. We haven't reached a vaccination rate which ensures a herd immunity to the level that we are totally relaxed. So we have to increase our vaccination coverage. At the same time, because it's still here, we have to follow the public health measures, wearing masks, safe distancing, avoiding crowds. And when you get symptoms, go to the health facilities. Don't medicate yourself. Use professionals to medicate. And health professionals, there is abundant guidelines and so forth to how to do surveillance, how to do tests, how to manage COVID. Use those to ensure to service the public.
Zahra Abigaba, UBC News Tonight.